of having a 1-year-old that doesn't play ball on a particular day when you need him to. So it's all sorted now. So welcome to the third instalment of returning to the office. So we've done a couple of these already now, and hopefully for anyone that's already joined, you'll find this one just as useful. If you haven't been to them before, we're going to cover some high-level stuff, some things we have covered in previous ones, and we're going to go through a couple of those bits again because they're quite important to just keeping at the forefront of our minds whilst we're planning for people to come back to work. And then the updates in terms of the latest government advice, what they're saying in terms of offices and how we can get back to work safely and make what they're saying and the workplace COVID secure. So get started. This session is being recorded, but do feel free to chat any questions that you might have, or use the Q&A, or raise your hand if you want to talk and I can unmute you at that point. Otherwise, there'll be an opportunity for questions and discussion at the end. So the latest government campaign is, it's the same slogan that they had in the last session that we did: stay alert, control the virus, save lives. But their advice changed slightly. So we've used the updated advice that is on their website at present. So it's help control the virus to protect yourself and others when you leave your home. You should wash your hands. We know about this and hopefully everybody knows, but it's good to keep those reminders again at the forefront of our minds because people do forget, and we're still bedding down this new habit, this new way of living our lives and being much more aware and conscious of the actions that we take in terms of what we touch when we touch our face and washing our hands in between. Covering your face, wearing a face covering over your nose and mouth. You've all seen the images of people where they don't cover their nose, and I'm sure you're seeing it out and about in public as well. Every day that my partner goes to a shop, he comes home and says, it's always the blokes, it's always the blokes. They're never wearing masks. I don't understand, it's young guys. And anyway, we all see it. Make space, stay at least 1 meter away from people not in your household. So it's changed slightly because prior to this, it was 2 meters, and now they've relaxed it a little bit. They want you to still do 2 meter social distancing where possible, but 1 meter is more acceptable, with possibly some other precautions like a face covering in place if you're in an enclosed space. And again, if you're feeling unwell, they now have opened the testing up. So again, before in the last webinar, the testing wasn't available to the general public. It was more for people who worked in healthcare and were vulnerable and so on and so forth. Now it's open more widely to everybody who has those symptoms. And there's a link there to that site. So from the 1st of September, we probably all know they're opening up all the educational institutes again, colleges, schools and nurseries, and universities as well. And then from the 1st of October, they're going to let people do conferences, exhibitions, stadium audiences, concerts and so on and so forth again, all in this secure COVID-19 way. They actually said from the 1st of August that businesses could go back as well. So I haven't put that in here because it's not on their website anymore in the sense of this particular piece of advice. But from the 1st of August, they've advised that offices and workplaces can go back or continue to work from home as long as they have this COVID-19 secure workplace. And then they've said in November, the ambition is to scale back remaining social distancing measures, but is contingent on a number of factors, including the consideration of specific challenges as we all move into winter. So we just need to keep monitoring it. And the reason I keep putting these at the front of the slides is to refresh myself on what the latest advice is, because it changes very quickly. And we know that a rash has now been added to the list of symptoms. So one of my pieces of advice is, if you have got posters up, so I went to a client's office last week and they had a poster that's a bit outdated with the symptoms on it, and they didn't have the rash on there. So I said, you know, we need to get that updated, because you want to keep reminding people and put it at the forefront of their minds what the symptoms are and what to look out for in their own health. So, health and safety overview. So this is a slide you may have seen before if you've been to these sessions. It's really important that all businesses display in some format that health and safety at law poster, and there's a link there. I'll send these slides around afterwards and they'll be accessible from within the office management portal as well for you to download. So click on that if you haven't got it displayed in your office, check it's the up-to-date one. It's been around for, I think, about 6 or 7 years now, this one. But it is our duty to ensure as employers that so far as reasonably practicable, the health, safety and welfare at work of all employees. So if you have 5 or more in your business, you need to have written procedures down for your risk assessment, your policies, setting out how you keep people safe and your responsibilities as well as theirs, because it's just as much their responsibility as it is yours or your business's as the employer. The HSE is still advising of an increase in inspections to make sure that you're saying what you're doing, what you're saying you are. So if you're stating that you're going to put something in place and a measure of control on your risk assessment, they'll be expecting you to have done that and to be maintaining that control. So make sure you're all in check, you've got your policies and procedures in place, and that you know the law and your responsibilities and you're adhering to them. Then we go on to what is reasonably practicable. So it's about the balance of scales, and we've talked about this again before. So looking at the risk, i.e. an injury, danger, illness, hazards, whatever you might want to call it, they all come under the risk. And then the sacrifice being, how long will it take you to implement it, or what is the time that it takes away from perhaps other business activities and earning money and revenue for your business versus controlling this risk, as well as the effort and the cost to do it. And it's about getting those right. And it's no different where COVID is concerned. So if you think that, for example, shutting your office down completely and everybody working from home is the safest way to run your business for the next 6 months, the next 3 months, whatever it might be, but you're losing money as a result, does that logically make sense? And you're having to let people go. Or if you could get some people back into work to make your profits and your revenue increase and keep your business afloat and do it safely by putting certain control measures in place, does that make more sense? Probably yes, because there's that balance. And the government aren't expecting people to just sit and wait for this thing to go away. They're now encouraging us to get back to work. So thinking about those scales in the back of our minds all the time as we go through this. There's an example here of to spend £1 million to prevent 5 staff suffering bruising their knees is obviously grossly disproportionate. Spending that £1 million to prevent a major explosion, which could kill 150 people, is much more proportionate. So hopefully that helped you to have a greater understanding of what the HSE are looking for in this balance of scales. RIDA reporting remains completely unchanged since the last set of regulations in 2013. So this is the reporting of injuries, deaths, diseases or other dangerous occurrences. And the failure to report, I think the starting fine is £20,000. So you need to make a report to RIDA when an unintended incident at work has led to someone's possible or actual exposure to coronavirus. It needs to be reported as a dangerous occurrence. The worker has been diagnosed as having it, and there is reasonable evidence to suggest that it was caused by exposure at work. Essentially, if you can't rule out it being caused by work and they can't ascertain that it was definitely caused by somewhere else, for example, they can't trace, if they went to a bar and they haven't had the track and trace from that bar to say that there's been an incident and an outbreak of COVID, but at work a few people have had symptoms and maybe there's a trace that someone had it at work some time ago, there's a possibility. And wherever that possibility can't be ruled out completely, you need to report it, because it's better to do that than not and be investigated and found out and then questioned by the HSE as to why it wasn't reported. So take the cautious view there. It needs to be reported as a case of disease under those categories. And obviously, if a worker dies as a result of occupational exposure to coronavirus, you need to report it. And I believe you have to do it within 24 hours of knowing that there was an incident of fatality. So make sure you have somebody responsible for reporting to RIDA and they know about these responsibilities. It might be you as the office manager. So have a look on the guidance here. There is quite a bit that they've published on coronavirus. So have a little read of that if you're not sure and you're not clued up on what to do, just so you know it. And obviously if something occurs, you've got the link then, you can save this to your browser as a favorite. And if something occurs, be it just someone has contracted it and there's been an outbreak and you're not sure whether it came from work, you've got that link to hand and you can go and have a look at it as soon as you know and give yourself the comfort as to whether you need to report it or not. So I would definitely save that link to your favorites. So a quick check-in now on facilities. Again, we've gone through some of these before, but I just want to raise it to anybody that is thinking about opening up or already has. So making sure that you do things like look after the Legionnaires, the L8 regulation. You should have a duty holder and a responsible person. They can be one in the same. And you need to make sure that you review a water risk assessment. If you've had one done in the last 5 years, that should cover you unless you've changed your water systems within that time. So make sure that whatever's being detailed on there is required actions to mitigate and manage those risks are being done. So things like flushing weekly, and that means running taps, showers, whatever it might be. If you haven't been in the office or you've had low occupancy in the office for a while, again, some of my clients are getting 5-10 people in a week maximum. Make sure that your maintenance company or whoever does this for you is doing the flushing, and they should be flushing all the outlets, because you can't be sure that they're all getting the usage that they normally would, where they're being used more or less daily. Check in with them and increase the occurrence of these measures if you need to. Descaling, so again, tap heads, taps. You might not have any tanks in your property to look after, water tanks, but it should all be on your risk assessment and with your maintenance company if they look after it for you. And the monthly tap temperature testing to make sure it's between the parameters that it needs to be. Doing all those things before you open up and continuing to do them once you're open up, and being mindful of the activities and the volumes of people and capacities and things you've got going in and out will help you to manage your property safely. Emergency, oh sorry, it's flicked onto all of them now. Emergency lighting, testing all fittings and making repairs as needed. You need to make sure that that is still being done. Your monthly flick tests to make sure that all the fittings are working as they need to be, and your annual discharge tests, your 3-hour drain down to make sure that the batteries and the ballasts hold that amount of time. All of this will make sense when you talk to your engineers. Air conditioning, check to ensure that the maintenance is up to date. Run the systems before making sure, before allowing staff back in. Have your filters cleaned, and check with the engineer as to what they've done in relation to COVID. So things like increasing the existing ventilation rates by adjusting the speed fans. They're quite simple, and they can adjust them either per unit or en masse from the building management system, the BMS. Operating the ventilation system when there are people in the building makes sense. Monitoring and managing filters in accordance with manufacturer instructions. Opening windows and doors if you're able to. If not, then increasing that ventilation, that fresh air circulation should be should suffice. And then this changed slightly. So I read a little while ago that desk fans shouldn't be used in offices, and I think I even wrote about it on our Slack channel if you're part of that. But having done the research again this week, there's been a slight change, and what they're saying now is using ceiling fans. You can imagine if you're in an older office and you don't have aircon, you have those awful whirly things that you tend to see when you go on holiday to Europe in the room, and desk fans. They can be okay to improve circulation provided there's good ventilation. So, i.e., if you have your air conditioning on a good level of ventilation, you could have desk fans for people. If you have open windows, open doors to fresh air outside, you can have ceiling fans and desk fans. So what they're looking for is to make sure that there is fresh air coming in, rather than all that air that's coming out of us and that our CO2 just being recycled and siphoned around, and therefore fans and things are just continuing to push it round. They're looking to make sure that there is a good volume of new fresh air coming into the office. Making sure you carry out a deep clean, and then consider what cleaning you're doing ongoing. So are you going to do a weekly, monthly, electrostatic clean or fogging, whatever it might be? Talk to your cleaning contractor or your cleaning provider about that and put some measures in place. Do you need to increase the cleaning? Again, in the in the government's office risk assessment advice, they talk about increasing your cleaning to manage common touch points. So do you need to perhaps play with the hours that your cleaners work? If you haven't got the budget to just up your cleaning and implement a day cleaner, can you pinch some hours from the evening and adjust it and put them into the day instead, so that you've got some time in the day where you know you're getting a good clean part way through. First aid provisions, checking that you've got adequate supplies and people who can look after this in when people start coming back in. If you're doing a split shift system, can you make sure that you've got first aiders from both sides of that split shift system? Do you need to put appointed persons in place? They're people who aren't trained in how to give first aid, but they're people who, in the event of an incident or an accident occurring, know how to take control of the situation, so can recognise that they need to call 999, for example. They can make sure that people stay away from the person who's had the accident and just take control and just be that sensible, level-headed person to deal with things. Can you, you know, combine with neighbouring tenants, neighbouring properties to share first aiders and divvy up who will help who in the situation where you've got less people coming in? What about your building management? Can you lean on them? All these sort of things to ask and to check and make notes on your risk assessment as to what you're doing. Same with fire safety provisions, monitoring the number of staff that you have coming back in, and also then the level of fire marshals and fire wardens in relation to, in terms of the capacities and the ratio of staff to marshals to get people out. So it might be necessary for you to implement more appointed fire marshals or wardens and give them some brief training, make sure they know the exits and the procedure and the assembly point and so on, and put them in place. We've had a question, so do we know if there are any updates to CPR or first aid instances? So in relation to CPR, so the advice, as far as I'm aware, is that if someone is comfortable to give it to somebody, then that is their call. And that as a business, if you don't already, then the recommendation is that you get the masks, and that people, if they're not comfortable, to just simply give chest compressions, which would generally suffice to keep somebody alive whilst the ambulance are on their way. I think it takes about 6 to 8 minutes for an ambulance in London to get to our buildings. So yeah, so if someone's just doing the staying alive style chest compressions for the duration of that time, or they're swapping in and out with someone else, because obviously that it's quite hard work. If you've ever done it, it's quite exhausting. That's the advice. But if you don't already have them, you can get disposable masks really cheaply with the tube. I would probably get them anyway, because people, even when coronavirus is under control and is 1 in a million people are getting it every day, or whatever the stats might reduce to, you want to probably still make people feel safe by having provisions like that in place, where they're not doing mouth to mouth. There's something in between. As far as I'm aware, they're still not doing first aid training, but I expect that 1st of October date, when people can come together a little more, I suspect that's when we'll start to see first aid training coming back out as well. Housekeeping, so making sure that you do thorough checks, walk around your office. You should be doing this generally anyway, each day, each week, doing formal checks, writing it down on what's going on in your office. Lights out, leaks, are the fire extinguishers in the right places? Have they got the appropriate signs up? Are the fire doors closing? Are they closing in good time? Are all the seals intact, and so on and so forth? Cables, trip hazards, comms rooms, cleaning standards, and so on and so forth. So making sure that you're really on top of that, particularly now. So I'm not going to go through all of these, but I just want to do a screenshot to show you. So the document that the government produced, which I said in the last webinar, I think it was really quite, I think it is really quite good. It's comprehensive, it's simple, it's clear to follow. If you haven't already had a look at it, the link is there. So again, maybe save this one to your favourites. But you can see how often things are being updated. It's roughly every 10 days, okay? And this just shows we're all still learning. As this evolves, things change. Best practices created as they learn. So review these updates if you haven't already, and update your risk assessment according to this latest guidance, according to these updates that we can see on the screen, in case it affects the things that you've put in control and actually you need to make them slightly tighter and more stringent, or you can perhaps relax them and continue to monitor it. You could say that you might dip into it every other week, once a month, but you can see in the period of about a month, about 2 months, 14th of June to the 12th of August, there's been a couple of pages of updates from the government. So things will continue to move and change for some time. So making sure that you've got that note to dip into the document, dip into the websites and have a look at it and update your risk assessment, version control, date change it accordingly, just like they have here, then you'll be on top of it and you'll be absolutely fine. So how do we get back to work safely? I've followed the 5-step process that the government have outlined here because there's so much documentation out there. I'm not going to start reinventing the wheel for these webinars. We're going to follow it and we're going to talk through it in the mind of an office manager and how we get things ready. So carrying out your COVID risk assessment. So before restarting, you should ensure the safety of the workplace by carrying out a risk assessment in line with the HSE guidance. Now, as of yesterday, the HSE website was down for maintenance. So if you're going to go looking for this today, you might find the same. I don't know if they've got it back up yet, but all of the HSE guidance was completely offline because it was down as a site as a whole. So fear not, it should be back up soon, maybe today. Consult with your workers or trade unions. This can be in the form of staff surveys or more formal roundtable discussions where you could do it in person or virtually and have people on and you go through the measures and say, does anybody have any suggestions? Would anyone like to share any further thoughts or feedback and so on? But making sure that you have some sort of consultation recorded is what they're looking for here. And then sharing the results of your risk assessment with your workforce on your website. And this is the template that we've got in the portal for anybody that hasn't seen it already or that isn't a member of the office management portal. It's free to be a member. And this template is just £10 to download. And we've got about 8 pages, I think, of suggested things that you can put in place and control measures and hazards in relation to coronavirus. So how do you carry out your risk assessment? I'm just going to flip back a second. Yeah, so how do you carry out your risk assessment? Walk around your office and visualize people being back in there. Quite literally, if you've already got a few people coming back, great, speak to them, ask their feedback. Anything you've put in place already, say, how do you think this will work when 40 of us are back in, 20 of us are back in, when 100 of us are back in? Do you see any issues? Is there anything you don't think works? Is there, you know, I've put a sign there about anti-backing your hands. Are you taking notice of that? Are you doing it? Get some feedback from people that are already in if you have that luxury to do so. If not, go in, walk around, note down the hazards and visualize people being back and start to detail how you're going to mitigate those. What you might do, and this is absolutely fine, is get your office ready first in the sense of all the things that you want to do, making a list, and then transitioning all of that to the paper and to your risk assessment. And that's absolutely fine. And as you go through the risk assessment, you might then find other areas that you need to kind of plug and then put in place physically in the office. Look at high touch areas, common parts and pinch points, and remove items that don't need to be there. So again, at my clients last week, and I'm going to Birmingham on Tuesday to see another client to do another risk assessment. There were things like paper, like notepads and pens in the meeting rooms. And I said, do you really need those here? No, we don't. I just didn't even see it. So we've removed them. Magazines at the coffee table in the reception waiting area, get rid of them. It's just all things that people can pick up and put back down, and they're not going to get cleaned in between. You can't control it. The best thing to do is remove the risk. And it also means that you're not then subjected to criticism, because people are going to just be nitpicking here, right? When they come back in, people are all going to have opinions. So, and that's fine. You need to embrace that if you can. But, you know that you only can do so much, and every person that brings a second set of eyes to you may have a different opinion. And some of those may be of value, and some of them you can just disregard and throw away with a pinch of salt. So looking at those kind of common items that just don't need to be there, the pretty things that people can fiddle with and touch, can't control, remove them. Consider where's best for signage and antibacterial stations or hand wash stations. If you've got the money and the budget to put the mobile hand wash stations around your office, wonderful. Where's best for them? So again, right as someone walks into your reception area, you want an antibac station there ideally. Wash your hands, or please sanitize your hands before approaching the desk. And that way there's some comfort for you, for the person that's walking into your office, for all of your staff, that every single person that comes into that office comes in, no matter what they've touched on the way through, their hands, if they do it properly and follow the guidance, and again you can put the sign up, they should be clean and they should be safe. Add to your ratings for how likely something is to occur and the consequence. I had a call with a client on Monday, I think it was, who has got my risk assessment template. I'm their health and safety officer, but a very small office. So they didn't want me to do the full risk assessment for them. So we've just done a few template items, and he is doing it now for a film set that they're going to go and film on. And he has to give it to the film companies like the BBC and so on. Anyway, he phoned and said, you know, surely the consequence of all of this is just death, 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 death. And I said, no, it's not. It really isn't, because that's the worst case scenario. And the consequence at that level isn't necessarily just one single person getting it out of 200 or 300 that are in your office that could get it. So it's back to that kind of scale, thinking about, okay, it might be a 5 if I put no controls in place, because the chances, so the likelihood, if I put no controls in place, are that it's going to spread. If we have no hand wash stations, if we have no anti-vax stations, if we don't increase our cleaning, or if we remove cleaning altogether, if we didn't allow social distancing, if we didn't encourage mask covering, if we didn't remove capacities in the office, in the desks or the meeting rooms or whatever it might be, all of these things are controls that contribute and add up towards reducing and mitigating that risk. So yes, if you didn't do anything, the risk level would stay high and the consequence would stay high, because the chances are someone may die from it because of the amount of people that it will affect, rather than just the one person. It's because of the knock-on impact, and that's the consequence. So don't think of it, or try not to think of it like everything is just doom and gloom, because everything you do and everything you implement will bring that risk rating down. So hopefully that helps. We've got a question. Is anyone finding that staff want to wear face coverings in the office? So feel free, everybody, to chat in the chat about this. I think you should be able to chat to everybody if you change the drop down from panelists to everybody. But what is everyone else finding? Has anybody been back yet and found that people want to wear masks? In my experience with the clients that I have been in and seen, I go in and wear a mask most of the time, and so some of them, what they've implemented is mask wearing where they know they're going to be in close distance of 1 meter or less. So say, for example, they've implemented a one-way system to keep the distance, but at certain points, this one-way system kind of overlaps a little bit because of where their toilets and meeting rooms are. So they have one door in, one door out, and they can't change that unless they literally change the structure of their building and their fit out, which they're just not going to do. That's where that unreasonable balance starts to come in. So what they've said is, when you're going this way to the toilet, wear a mask, because the chances are you might just have that pinch point, that small crossover where you might bump into somebody. I know another person that said for going to the toilet, they should wear masks as well, or I don't think they've said should, I think they've encouraged them to, because again, there's that pinch point opportunity where you might just come into close contact with someone. So hopefully that helps. But yeah, anyone else chat? But definitely, Megan, you're right. Masks for traveling in, obviously if it's TFL, then that's mandatory now. And yeah, I think that's the thing. I think it's making them available if you can afford to, and saying we encourage. It's a really nice soft word, because you cover two things. Then you're not enforcing it for people that are against it, that aren't comfortable, and therefore might not come back in if you say everybody has to wear a mask. And the government might change this, right? So that will be their decision, and that's fine. We can all abide by it. But you as the employer, you might not be comfortable saying you have to wear a mask. So by saying we encourage the use of masks and face coverings for when you're in meetings longer than 15 minutes, for when you're going to the toilet because of pinch points, whatever it might be, it's much softer. And you're hitting then the people that are anxious about coming back. I always try and think about these and how all the things you do would resonate with them. So if you're saying we encourage the use of masks, for them, it just breaks down a little bit more of a barrier of comfort, like that sign at the front that says, anti-vax your hands before you come in. You know, if you've been to the hairdressers, my hairdressers, I was super impressed with them. They, you walk in, you're not allowed past this sort of hazard tape line, and you stand at that line, which is only about 1/2 meter or so away from the door. They literally come up with you and antibac on both your hands, and they watch you do it. And then when you've done it, or whilst you're doing it, and you're wearing a mask, obviously, they take your temperature, and then they say, right, we're adding you to the track and trace system, which I assume is just them letting you know, because they'll have it all on their booking system anyway, but I think they just check you in. And then you take a seat directly in your chair. Obviously the hairdressers are wearing the mask as well, but I'm really impressed with that. They've got posters and signage up and all sorts. And that said, one of the other pieces of advice I will give at this point in relation to your risk assessment is, whenever you do go and venture out into supermarkets, into your hairdressers, into bars, restaurants, wherever you're going, wherever you're comfortable to go at the moment, take note of the good and the bad things that that people are doing, that these businesses are implementing. I found that Sainsbury's near me was terrible. They had terrible signage. No one was taking notice. No one was social distancing. Now people are wearing masks, but some people aren't wearing them properly. Whereas the Tesco round here, and you've probably seen some of their adverts, is really, really well managed. So they have like a flow through the store. You can't get to certain points. Waitrose is the same. So my advice is to take the good bits and remember the bad bits, and don't do it as they've done in the bad bits, and just learn from all these other places, because everyone's in the same boat. Yeah, so the government advice has adjusted slightly. So I don't know if I've made a note of it on here, unfortunately, but they've basically said that from the 1st of August, they're I don't know if the words are encouraging or employees can, I'll try and have a Google after this and have a look, but employees can go back to the workplace, providing it's COVID-19 secure. That's their stipulation, is COVID-19 secure, and all this stuff is you getting COVID-19 secure. So as long as your workplace is COVID-19 secure, you can have staff back and or continue to get them to work from home. I think they are, to be honest, getting to the point of encouraging it, and I'm starting to do the same, because I'm fearful of things like the economy, the end of the office, the effect this is going to have on people's mental health, our social behaviours, or our ability to interact with human beings, you know, how it affects businesses and so on. So I'm starting to look at it in the same way, but just I think there's so many sensible things that we can do to control it and the spread of it. So I believe they are. So re-rate once you've got your controls in place, monitor your risk assessment regularly. There's another link there for more information from the HSE, if their website's up and running, about risk assessments and how to do them. Then what do you do next? So when you've completed your risk assessment, a lot of people think you then, if you have more than 50 employees in your business, you then put that whole risk assessment on your website. Please don't do that. It will be up for scrutiny by your employees if they see it, your clients may see it. Just share the results. There's a really, she says it having written it herself, but there's a really nice simple policy of what you've done, what your expectation is of your employees, of your visitors, of your contracts, and how you're keeping people safe within the portal. A really simple, I think it's £10 as well, really simple guide you can download and use and amend. They also want you to print this, so I've put the link in here to the poster. They want you to print this and sign it on behalf of the employer. I would say that's probably, you could sign it if you want to, but I would probably make it a director, and then you could put your name into who to contact, because you might now be, I think they're looking for people to start appointing COVID officers, so you might be the COVID officer, or you might just say health and safety officer is the COVID officer. And yeah, these, you'll see, these are the 5 things we're going through now in this session. So they want you to have that poster up, and I've said here, if you have multiple floors, put one on every floor. This version has been updated, so if you've already printed this some time ago, this version is updated, because previously it was just the 2 meter social distance, whereas now we've got this other point which says that where people can't keep 2 meters apart, basically 1 meter is acceptable as long as you're taking additional mitigating actions like face coverings, reducing time that you're spending together, and so on and so forth. So be aware, they are updating things regularly, so we've got to be mindful of that. So if you've got it up already, take the old one down, pop the new one up, put it on your website, and then put the results of your risk assessment up. Just 1-2 page of policy. We've completed a risk assessment and these are the actions we have in place, e.g. social distancing, split shifts, hot desking with increased cleaning facilities, access to anti-bac, access to masks, like in the case of Kimberly, and so on. Okay, so next section, develop cleaning, hand washing and hygiene procedures. This one's the easiest one, right? So it's all about the signage. I don't know if I've told you guys before, but I was called the laminator in one of my old jobs as the head of facilities, because I used to just put signage everywhere and it was all laminated. But it is never truer here. It is all about the signage. If you have signage up encouraging people, you give people that comfort again as well. You're doing your duty that the HSE are expecting, in the sense of putting measures in place, encouraging people, reminding people, telling them how to wash their hands properly, reminding them of the symptoms to look out for, and so on and so forth, and then making sure that people follow that guidance. Not 100% sure. Yeah, so Claire's just asked about the risk assessment and just wants to have a little bit of clarity on that. So you don't put your risk assessment up. So say, for example, you complete your risk assessment and in terms of the office, you put a couple of controls, or many controls I'm sure, in place. So it might be that you've implemented a one-way system. So you would say, do you want me to bring the policy up on the screen? And then I can show you what sort of thing I mean. Just bear with me a second and I will bring it up. And then I can show you. I'm much more of a visual person. I can't talk stuff unless I can see it, so it's easier for me as well. So we have got, so it's in the portal, it's called Published COVID Procedures and Policy in the Health and Safety section. And I just need to check that you can see it on my screen in a second. Let's just put that over there for a minute. Here we go. Okay, can you guys see it now? Should be a Word document. So it's really simple. You put in your health and safety policy blurb here. So it might be at the start of your health and safety policy saying, we're committed to health and safety policy. We take it very seriously. We protect employees, visitors, contractors, the board and so on, take it seriously. We meet regularly, whatever it might be, just a short instruction there. And then what your policy is aimed at, so breaking it down, talking through your COVID risk assessment, so you can even put the date that you completed it in, or just the month and year, and a generalisation on what you've done and who they can contact. So this would be your COVID officer. And then actions you've taken, so introduced sanitising stations, implemented a one-way system, limited desk and meeting room capacities, etc., etc., etc. So just high level. I wouldn't detail absolutely everything because you'll end up with a much bigger policy. You just want to do, this is the risk assessment summary, exactly. You just want to do your high level points. Imagine someone's never been to your office before and they've got no idea what they need to do to adhere to and follow these guidelines. You just want to give them a brief overview to say, this is what you need to do. And obviously you'll have signage up in the office, you'll have arrows and directional arrows and whatever else it might be, but you just want to be able to send this round, pop it on your website so people know that you've completed your risk assessment and this is what you've implemented as a result. You might not say things like, we have been through the cleaning schedule and we've increased cleaning and now the cleaners are going to look at cleaning door handles, light switches, cupboard handles, taps, sinks, and they're going to clean it 3 times a day. You're not going to go into that level of detail, and you probably wouldn't even go into that level of detail on your risk assessment. You would do it really high level, but what you would say on this is we've increased cleaning frequencies. Something really simple, high level. Employee responsibilities. So what we expect you guys to do, because you have just as much responsibility to keep yourselves and everybody else here safe as we do as your employer. So what your responsibilities are as an employee. And there's probably going to be a few more on here compared to what you've done in terms of your actions. So again, we've added some stuff here. And then visitor and contractor responsibilities. So what's this? It's four pages. You can reduce that down. I'll always, in all our templates, I'll always try and give you more than less, so you can extract and add to, but generally it will be kind of overkill rather than under. And then this, apologies, I couldn't find any good symbols. I expected there to be loads out there, but you can do something really simple. Put this around your office and also put this on your website for 6, 4, 10, whatever key things that you want people to do. So if you want people to wear a face covering when they're going to the toilet, just put wear a face covering for meetings and toilet breaks, or when you're going to common areas, something, you know, as simple as that. Does that help? Show what I mean. It does. Yeah, perfect. So it's a summary, it's high level, because your risk assessment, like the example I've put on the portal, it's 8 pages long. You don't want to share that. And you know, if staff go and see it, and you have those people that I call drop dead Freds who just want to tell you how to do your job, and if you're in a bigger office, you'll probably have a dozen of them. You just don't want them seeing it. You want to make sure that it is as the government advised, which is, have I shared the wrong screen? What can you guys see? Can you see the main presentation? Can you see? Yeah, you can. No, you can see. See it? You see? I think you can see it. Let me know if you see my notes or the other one. I'm having a day like that today. We can see your notes. Okay. Thank you. There we go. I thought so. Right. Sorted. Okay. So, do you know, so I'm just going to share. I just dropped my son off at his nan's, and I said, he is completely discombobulated today. And she was like, whoa, what's that word? And I love that word. For a day like today, it's just so suitable. He woke up at 10 to 5, so that's why I'm a bit discombobulated and like, where am I? What's going on? Okay. So, develop cleaning, hand washing, and hygiene procedures. All these things are obvious, but encouraging people, this, you know, they put keywords in here. This is how the government and the HSE work. It's these keywords that we kind of have to read between the lines. So encouraging people to follow the guidance on hand washing. So back to you doing your signage and putting stations up around saying, stop, wash your hands, or stop, anti-bac, these kind of things. Back to you encouraging. Frequently cleaning and disinfecting objects and surfaces that are touched regularly. So this is their guidance. So you will want to try and increase your cleaning and make sure that you've got hold of their, I don't think it's going to be called an audit, but their agenda, their cleaning schedule, that's the best word for it, Hannah, in making sure that they are focusing on these common and high touch points every night, every morning, whenever they clean in the day. And if you can, I really would encourage having somebody partway through the day go around. It's a really good thing for perception, and again, just calming those people that are really anxious about it down, understandably so. And it gives you that comfort, and you can then demonstrate, again, in terms of health and safety, that you've done something measured and sensible to reduce the risk. Yeah, I mean, I'm not going to go through all of this, but things to look out for. So, making sure that if you are going to open doors in your office, it's fine, but making sure that they're not fire doors. I talked about this before, and leaving fire doors open just leads to too much of a risk. And the risk of a fire spreading through your office, although it's low that a fire will start, but the consequence of it, if it does spread through because the fire doors aren't closed, is a higher risk than people catching COVID, because quite quickly. So just being aware of fire doors and non-fire doors and which ones you're going to leave open so that there's less touch points. Checking your coffee machines, fridges, you know, all these kind of things, deliveries from suppliers, making sure that you are limiting the amount of people that bring stuff up to your floor if possible. It maybe goes to the loading bay and then one person goes and collects it if you have that luxury. And ideally, isolating it and putting it in quarantine for 3 days before you open it might not be possible, but if you need to open it, then obviously making sure that the person doing so is washing their hands after and getting rid of the box so that it can't be touched again and things like that. So just thinking about really kind of how you've lived at home for the last, can you believe it, 5 months, and the procedures that you would take to keep you and your family or yourself safe, and then implementing some of that and that commonsensical stuff into the office. Next is helping people to work from home. So in this one, they want you to take all reasonable steps. And again, reasonable is that practically, and the reasonably practicable statement, right? So what's reasonable to you might not be to another company who's got millions more money and access to it. So discussing home working arrangements, ensuring they have the right equipment, for example, remote access to work systems. They don't necessarily mean that you have to supply people with equipment. But for example, you would need the laptop or the PC, and if it's a PC, you would need the monitors for them to access systems remotely. So you definitely need to supply them with the PC, the machine part, and I would say keyboard and mouse. And then anything else is kind of that reasonable point again. So if you're a startup and you've got limited funds, can you afford to buy 10 staff, a £100 chair, and then, you know, a desk, and then do all these other things that you know, screen stands, footrests and so on? Or is it that you actually deal with the people who really need it because they're suffering? It's all that reasonably practicable stuff and what you've got access to in terms of time, effort and cash. Including them in all necessary communication. So when you've done your high level policy after your risk assessment, send that out to them. Do the bit beforehand though of getting their feedback and the consultation, be it through the survey or these round tables, whatever might suit. Looking after their physical and mental well-being, and this one's really, really key. So making sure you're assessing who's high risk, who's vulnerable, anybody that you know perhaps that has had mental health issues in the past. If you've got mental health first aiders in place, do you want to do maybe an open kind of consultation day with them where your employees can pop in and out and just chat to them about how they're feeling? Are they anxious about coming back? Do they need any additional support? Make sure you're abiding by the Equality Act at all times when you're assessing your employees as to who maybe is higher risk and more vulnerable, and encouraging desk assessments. So this, discussing home working arrangements and taking reasonable steps to make sure that people can work from home will include your desk assessments, and there's a little bit more about it here. So if you have staff working at home, you must still apply and manage the risks from their health and safety of display screen equipment. So working at the desk, on a computer, on a tablet, on a laptop, on a phone regularly, whatever it might be, they're all parts of VDUs and therefore DSE equipment. So there's some links there to temporary home working and long-term home working. And I think for most people, we're looking at long-term now and what you need to do. Employers have the same health and safety responsibilities for people working from home as any other employees. So the law is to train everybody in how to self-assess their desk setup. So as long as you are providing access to training, as long as you're providing access to training and encouraging them to self-assess that whilst they're at home, and then when they do come back into the office, if they've not been there for 5 months, making sure they're checking it at the office as well and doing competency checks. So it's probably no good to just send the email out saying, make sure you're working from home safely. Here's a checklist, you know, something like this image here, A, B, C, D, E, follow this. You want to get something back, some feedback, some engagement back, be it the checklist completed, be it, you know, an email confirmation saying, yes, I've read and understood this, or a test, whatever it might be. These e-learning kind of platforms tend to do a test at the end where they have to walk through and tick boxes to say whether their you know, screen's at the right height and so on. A lot of people do just tick away, and it's you know, a case of just ticking the box for them, quite literally. But for people that are suffering, hopefully they'll take it more serious and they'll reach out to you for support. You can do things like, you know, recording and retaining email reminders, saving them to your health and safety folder under DSEs to make sure you've got the evidence, because it's all about evidence with health and safety. Using a tracking method like an Excel sheet, there's some examples and templates again on the portal. Google Sheets, you can use Google Forms if you want to get people to fill it in, and therefore it transfers to Google Sheets, or like I say, more sophisticated e-learning training if you've got the budget to do so. So lone working is another thing to just consider when you've got people working at home, and also when people start coming back to the office. If you're not controlling it so that you've got shift patterns and people are agreeing to come back in groups of 5, 10, 20, whatever it might be, and you're just letting people go in and out as they want to, be aware that people are lone workers if they're on their own in that office. But someone who works alone without direct supervision, where there's no one to help in the event of an emergency. And employers have a responsibility to make sure that their health, safety and welfare is covered for all those who work alone. Working on a computer at home carries a really low risk, but there are other hazards to consider, such as the mental health pressures, working pressures, workload, and so on and so forth. So make sure you're in regular contact, and also not just you or their line managers, but people like HR. I've mentioned the mental health first aiders as well, and communicate who they can contact and talk to when working remotely. There's, I think, a lone working policy on the portal, and in our general risk assessment, and I think it's in the COVID one as well, but in our general risk assessment available in there, there's a whole lone working section. So maintain 2 metre social distancing where possible. We all know about this one by now, but again, signage to remind people, you know, cutting desks off quite literally with hazard tape, do not use this desk, whatever might suit you. Reminding people that they need to socially distance. They do discourage hot desking, but if you are going to use it, then they expect to see evidence of a clean in between. So if people are hot desking, say from one day to the next, or week to week, because you've got one shift coming in week 1, and week 2 it's the next shift, and week 3 it reverts to the first shift, and so on and so forth, and between pairs they're sharing the same desk, they'll be expecting to see competent cleans and records of that in between. And I don't mean records like a before and after picture, I mean just making sure that your cleaners are auditing to say desks clean, you know, that kind of thing, and that's being recorded. And putting people back to back rather than face to face or side to side. We've talked about this quite extensively, and there's so much out there from fit out companies and things on it, but you don't necessarily need to go and spend the money on screens, on reorganizing your floor, unless you want to have more people back in. You're going to just reduce the capacity and have split shifts that you can get 50%, 60% of the workforce, whatever's deemed you know, manageable in terms of social distancing back, then that's great, and you can manage it effectively, probably for some months on that basis. If you want, and your bosses want everybody back in, you're going to have to rehash it. You're going to have to put screens in place. Reduce meeting room capacities, remove chairs, consider lifts if they're part of your demise. If they're not, make sure that your landlord or the building manager have done something about it. So is there a sign in the lift that says face this way? And as people walk into the lift, they literally face away from the doors, so that if someone then, you know, the door's open and someone else is right there, that it avoids that face-to-face contact. Meetings should be done by telephone or video conference, ideally not in person, but encourage the use of face coverings if face-to-face, ideally less than 15 minutes. If they're over, make sure there's fresh air, ventilation, social distancing, and encourage face coverings. Another thing that a client had in their meeting rooms when I went last week was telephones. They've got some really lovely casual meeting rooms versus some more formal board meeting rooms, and in each of them they have a telephone handset. And I said to them, either remove them if they're not needed, you know, someone can just come out to reception and they can make a call if needed, or if they are using them, say for example one person goes into the room to do an interview, they're a recruitment type consultant and they want to use the telephone, just encourage them to put it on loudspeaker rather than picking up the handset. And you know why, right? Because the germs that sit on that speaker whilst they're on the handset are much greater than just the touch, and encouraging people to wipe in between and wash their hands and so on in between. Just thinking about all those things. When you do your walk around and your risk assessment and you set your office out, don't just do it once and rest on your laurels. Go and do it, you know, each time you're in the office. Get that feedback from staff, get a second pair of eyes. You know, I would welcome helping anyone with their risk assessment if they want it through my consultancy, but you know, it's a case of using common sense and going in and seeing what you can do to make it safe. We've talked about staggering working hours, implement shift systems. There's a system called When I Work. We've talked about it on the portal and some of the forums, which is free up until a certain point, and you can implement shifts and patterns in there. It's also an app. It's quite good. Doing trial runs with a few trusted staff, getting the feedback from them before you open up to the masses, considering breakout areas, blocking tables off, so on and so forth. So looking at all of these. And then where people can't be 2 meters apart, manage the transmission risk. So where it's not possible, do everything practical. So again, they put it in here in these kind of reasonably practical words. So considering whether an activity needs to continue for the business to operate, keeping the activity time involved as short as possible. So they recommend 15 minutes, as I said. Screens, barriers, back-to-back, side-to-side, staggering arrival and departure times, and reducing the number of people each person has contact with by using fixed teams or partnering. So all of these we've talked about a bit already, but this is their kind of new area that they've added to their list of recommendations. So use common sense. I say it a lot because it really is, I think about that. I think so much of office management is common sense. My partner doesn't have a lot of common sense, bless him, and he's a teacher and he's fantastic at his job, but he would be a terrible office manager. He really would. Whereas I don't think I'm highly intelligent. I could never do teaching. I could never read a book and then teach it to people. She says doing webinars and training, but I think it's very different because it's about the experience as an office manager I've had. I could never sit in front of a class of students and talk to them about English and history and things like that. I just can't. And I think I'm high on common sense and somewhere average on intelligence, whereas he's low on common sense and higher on intelligence. And I think a lot of this is commonsensical. So I know there's so much pressure on our shoulders, on your shoulders right now, and it feels like a minefield. It really isn't. Just make a start. If you haven't already, go in and take your time and walk around. Use the templates if you've got nothing else to lean on. I promise you they'll help. And just make life for yourself and your business easier by considering what that normal work environment looked like pre-COVID, picture it, and then implement these sensible, realistic and effective ways to reduce that risk. Accept there is always going to be room for improvement, and every single person, every single office manager, every single business, every single county, country, continent, globally, we're all still learning. You are not on your own here. And review suitable capacities. Like I said, is it that half that's the best way to go? Is that the best way to start, at least, or maybe just under half, and then gradually increase from there? Remove chairs, block desks, add signs, and remember that every single step, every measure, every procedure that you and your business put in place counts towards reducing that risk of spreading the virus. And that is the expectation from the government and the HSE. So if you do say to people, wash your hands before you come in, sign to say these are the symptoms, don't come to work if you're feeling any of them, and get a test. If you're doing temperature checks, if you're encouraging face coverings, if you're doing social distancing, if you've reduced capacities, if you're not allowing visitors, if you're controlling deliveries, if you are increasing cleaning frequencies and you're looking at the schedules, if you're doing better housekeeping, every single little one of these things, although they don't seem like much, added up all together, really quash that risk right down. Okay, so to quote Tesco, every little helps, and it couldn't be truer here. Are there, I'll just do a quick update on furlough actually before, I'll see if there's any questions before we go on to furlough. Are there any questions on anything to do with the risk assessment, opening your office back up, any concerns anyone's got? Have we got another question here? Yeah, so, sorry, I missed this earlier. When you say 50 employees or more, do you mean across the whole organisation, or do you mean in each individual office? I believe it's your organisation as a whole, if it's in the UK. I believe it's businesses of 50 employees or more rather than premises. So I'll check and I'll confirm, but I believe it's a business as a whole. You have more than 50. That's what they expect you to do. And I don't know if I covered this in enough detail, but it's an expectation. So it's not a legal requirement. But when the HSE and the government say this, unless you've got a really good reason not to do it, kind of just want to do it because they're expecting you to. If your boss expected you to do something, you would do it. They're kind of our bosses where this kind of stuff is concerned and health and safety is concerned. So it's not the law. You're not going to get fined for not doing it. You'll get fined if you haven't done a risk assessment and you haven't made it COVID secure and you've opened up. And there is a 2-year maximum prison sentence for directors if there's a complete and utter failing. It won't happen to your business, don't worry. I'm not scaremongering, but just so you have some of the facts here in case your bosses aren't taking it seriously. But yeah, I believe it's the business, but I'll confirm on email after. Okay. Any other questions at all from anyone, or any chats? Has anybody opened back up and got any stories to tell, any experience, any learning lessons? Be lovely to hear if you have. So furlough update, just very quickly, and I'll say it again, I'm not an HR specialist or advisor. I dip into HR probably less than you guys do, but I think it's useful to just give a little bit of an update. So changes were brought in again in relation to furlough and the furlough scheme and how much the government will pay versus the employer now. So there's employee contributions that are starting to take place. And the table that I've pasted below just shows what's on the government website again in relation to how that changes. So the government will pay 80% at the moment, and then it drops down in September to 70, in October to 60, and the employer is expected to pay that shortfall. And the coronavirus job retention scheme, so this furlough scheme, closes on the 31st of October of this year. Okay. Oh, missed a bit. That's fine. Right. There's some useful links here for anybody that wants further resources or webinars, and some from the HSE here if their website's back up and running. Are there any other questions or anything else that anybody wants to cover in this topic? No? Okay, perfect. Well, I hope that's been a useful update for you. Top advice is just to keep an eye on the government's pages. The best thing to do is just open up, save it down as a screensaver, open up this, when she gets there, this link here to their document, save it as a favorite on your screen, and just dip in there maybe once a week, every other week, and go to this document updates page, because then you don't have to read the whole document. I think it's about 40 pages long now, and you can just see, okay, well, they've made an update to ventilation. I'll go to 2.2, whatever they said. Right, fine, that doesn't affect us because we're already doing it, or it's not applicable, and just keep up to date on those. We might not do another one of these. We'll see what happens between now and sort of September and opening up again, and then yeah, we'll see how it goes. We've got the Slack channel for anybody that's not joined it. There is a COVID section on there where people are discussing what they're doing and sharing ideas and information, and hopefully that will just continue to grow. So if you're not already on Slack, or if you are and you want further advice, then shout on there. I hope that's been helpful. Have a lovely day, everybody, and I'll see you very soon. Take care.